to CCS-P exam prep. You know what? We're going to learn a lot. There's a lot to talk about, a lot of different subjects, and I like these subjects because they aren't, we're going to learn something. And not only we're going to learn some things, we're going to augment some of the things that we already know. So let's get into it. Welcome to week 3, domain 5. Now, if you didn't remember, this is what's on the exam. On the CCS-P exam, there are 5 domains. Domains 1 and 2 are your largest. That's ICD-10-CM and CPT coding. So you know what? We should feel pretty good. Domain 3, this is research at 6 to 10%. Domain 4, 18 to 22% of the exam. And domain 5, 14 to 18%. And then you've got some medical coding scenarios. All right, and it's not 33%, it's the remaining. But there are going to be scenarios, and 33% of those scenarios will be either evaluation and management, surgery, and medicine. All right. All right. So now just want to let you know about the required texts. These texts are required for the exam. You need your ICD-10-CM expert for hospitals. Well, you don't need that one per se, but we recommend it if you intend to continue and take your CCS, your HCPCS Level 2, and your CPT 2024. All right. These are required. Now, if you're testing after May 1st, you'll need this 2024. If it's before April 30th, 2024, you need the 2023 manuals. But I don't think too many of you are doing that. So make sure you have 2024. Now, for this course, you will need Principles of Healthcare Reimbursement. You'll also need your certified coding specialist, physician-based exam prep book. These 2 books, you'll need them. Now, I've got a disclaimer for you. Yes, this is advanced professional coding, and you must know the following: ICD-10-CM guidelines and CPT guidelines. You got to come in already knowing it. So you should have completed parts 1 through 3 in the MCDC course or some other course. Now, if you skimmed your instruction, you may have to go back and refocus on those guidelines. And if you don't have the MCG manual, it's highly recommended. Now, we're not going to be talking about ICD-10-CM and CPT coding. We're not going to be coding documentation, no, but we're going to have conversations about it, but we will not be coding. However, we're going to have many conversations. We're going to have all 7 of the 5 tasks within all 7 tasks of domain 5, revenue cycle management. And I gotta say, this is another disclaimer. You have to be familiar with these topics. You don't have to master them. Be familiar. All right. Now, I am going to teach introduction to most of the topics. And I don't want you to panic. And when you look at your coursework, you'll see I'm giving you lots of resources, but they say optional, optional. So basically what we're talking about is pretty much what you need. Just saying. So you need to be familiar, not mastery. All right, make sure you master domains 1 and 2, CPT and ICD-10-CM, but not these other topics. It's just way, way, way too much, right? All right, so here we go. Task number 1, we're going to ensure the data elements are complete and accurate before submitting claims prior to payer. Number 2, we're going to interpret. Yes, we're going to interpret the insurance responses to identify the appropriate course of action. Task number 3, we're going to demonstrate the financial impacts of resource-based relative value scale. Number 4, we're going to associate the diagnosis code to the appropriate procedure. 5, understand the hierarchical condition categories or HCCs. 6, we're going to apply accurate code assignment for risk adjustment. And 7, we're going to differentiate the types of denials. Yes, so let's get started with data. And the way we're going to do it is I'm going to give you a little introduction to health insurance because our task is to ensure the data elements are complete and accurate before submitting a claim to the payer. So before we have that discussion, we need to know what is needed for as data for proper claims submission. So what data are we talking about? We're talking about the following. We need patient information, provider information, insurance information, dates of service, place of service codes, diagnosis codes, procedure codes, modifiers, charges for each service. We need signature of the provider. We need authorization and referral information, and we need provider NPI number. And we're going to talk about all of this, right? Now, when you complete a claim, it's going to look like this. In the professional coding world, this form is called the CMS 1500. This is the standard claim form, and it's used by healthcare providers to bill for non-institutional services. So anything that's not in an institution like physician services, clinics, therapists, etc. This is the form that you use. And now that everything is digital, you won't necessarily use a paper form, but in the digital world, this form is replicated. So every single column or row has a number. And as a coder, you're going to need to know each one of them. Now, billers will have to know all of them, but as a coder, you're going to have to know some too. So let's go ahead and make ourselves familiar with this form. Now, we'll need to learn how to properly fill out the CMS 1500 form, and this is also referred to as the Universal Claim Form. All right, so you're going to need the patient demographics sheet. You're going to need signed authorizations, and you're going to need the patient's insurance card. That's what we'll need to fill out this form at first. So let's go ahead and let's do it. Let's simulate, right? So let's look at the patient demographics sheet. So you basically capture all of the patient information, general demographical information, all right? And then we'll need the patient's signature. And this signature authorizes the provider to send the patient's protected health information to the insurance company for payment. And this signature also authorizes the provider to receive benefits or receive payment from the insurance company. So whenever you see I assign the benefits to you or assignment, that means that we give permission to the provider to receive payment on our behalf from the insurance company. All right, since we know what that is, let's go ahead and let's fill out this form. All right, so you look on the left, you see box 1. We're going to skip that because right now we just have the demographics on the right. So let's go ahead and make up a name. Okay, you have to put the patient's last name first. His last name is AMCI, first name Alex. Patient in the birthday, 1187, and he is a male. Then, so we go from 2 to 3. Then we go underneath and we put the address. There's the address, 8601 Six Forks Road. The relation to the patient is self, but let's continue. Raleigh, North Carolina, zip code 27615, telephone number 919-999-111. There's a lot of ones, right? All right, so you know what we're doing here. All right, so, and then, let's keep going. And so we fill that out, and we also said the relationship to the patient is self. And then we also filled out this section, and this lets the insurance company know that this condition is not related to an accident at work, auto accident, or other accident. There's no subrogation. Then we'll go to the bottom, and right on the right, you see that Alex AMCI signed his authorization. So we're going to go here and say that the patient has authorized the release of information. And we're going to say the signature is on file. Also, too, because of that signature, the patient also signed to signed the assignment. Okay, they assign we call that assignment when they're assigning the benefits to the provider. So because that signature is on file, it's filed away, we can place here that the signature is on file. All right, so we're almost there. We've gotten all of the data from the demographics sheet. Now it's time to get the data from the insurance cards. So yeah, we got to verify the insurance. And this is our insurance. This patient has Horizon Insurance, Horizon Advantage. Let's take a look at this card. We see the name, the member ID number, really, really important. Group number, contract type, effective date, the Blue Cross Blue Shield plan codes, the PCP's name, the name of the coverage, and the coverage is right here. So you can see it says in-network preventive care is paid at 100%. And these office visits and specialists, these are all co-payments right here, and deductibles and co-insurance. All right, information. And then down below, you've got your medication information. So this is all on the front, and all of this information is important. Now the back is important too, and the reason is because you need to know where these claims get sent. All right, so it says here is where you send your claims. Make sure that you send it to Horizon Blue Cross Blue Shield, and there is the address, and we have to make sure that's in our system. Now let's continue. Now we've got our cards on the right. Let's go ahead and fill out this form. So as you see at the top, this is group health insurance. That means that his health carrier was, or health coverage was provided by his employer. All right. So it says group number. So we're going to write group health. Then we're going to put their ID number. There's the ID. We're going to put it here. Then the insured's name is the same. then the insured's address. Remember, sometimes your insured is different. If your spouse is the insured or the person employed, that is where you put their name. Also, then you'll come down and you'll put the policy or group number here. From there, then you put the birth date of the insured. It is the same. The sex of the insured, and then you leave this blank, and then you put the insurance information here, and then they ask you, is there another coverage? And if you don't have any, you put no. And you've just completed the top of the CMS 1500. Now it's time to complete the bottom part. And the bottom part is where you basically put your charges, right? So this is, let's say, a fictitious charge sheet. Let's say the doctor said, all right, this is what the patient has, and they have a level 4 visit 99214, and it's $250. Here are their diagnoses: essential or primary hypertension, gastroesophageal reflux, and diabetes type 2. So there's your charge sheet. Go ahead and finish completing your form. All right, so I did. And if you look underneath, I put the date of current illness or injury. I put today's date because this patient was diagnosed with all of these charges on this date. It's not like it was a prior diagnosis. The name of the doctor that referred the patient is Dr. Jones. Also, their NPI number. NPI number is a number that all doctors have. It is required by Medicaid, HIPAA, and this national provider number will identify anyone who bills for services. All right, so there are some other dates that you put here. If the patient's unable to work, if the patient was in the hospital, you need to put their admission dates from and to. If there's any additional information, we don't fill this out because the NUCC, this is their area. And then if there's an outside lab involved, often whenever a doctor carries out lab a lab test, and then sends the results outside, you will indicate yes, and you'll put the charges there. And then here, you'll put your diagnoses. Really, really important. All right, so number 21, box 21, you put your diagnoses. So I'm going to put my first, it doesn't really matter which area you put it, but I'll put your first listed code there. Put I-10, E11.9, and K21.9. Go ahead and do that. But whenever you have in your system, if it says first, that's where you put it. So let's pretend that A means first. So put your first listed code, put E11.9 and K21.9. Then it's time for us to, and as you can see over here, just note that there is a prior authorization number. Somebody authorized this visit. Now our dates of service, 3/3/2024 to 3/3/2024. Place of service is 1/1. If you got a chance to watch the playback, the place of service codes instruction is on there. It's in the second page in your CPT manual. The place of service codes are indicated. This indicates where the service was rendered, and place of service 1/1 or 11 is office. Now the procedure is 99214. It says, and then if there are any modifiers, I'll put them here. You can have up to 4 modifiers. Now, this diagnosis pointer, really important. This is where this links the procedure or service to the diagnosis, or they call that linking. So this service is related to A, B, and C, all 3 diagnoses. The charge is $250. The number of units, 1. The rendering provider ID, this is their NPI number. So the provider that rendered the service is here. And usually we put his name up the top. So we didn't put his name, but that's fine too. Also, the federal tax ID number, patient account number, total charges, signature on file that says, hey, assignment has been accepted, the address, NPI number of the facility or the provider. It's the same as the rendering. And there you go. Now, you have to link the diagnoses to the procedures to establish medical necessity. So all three of these diagnoses establish medical necessity for this office visit, and we call that linking. All right. So that is the data that you need for claim submission. So you need the patient information, provider information, insurance, dates of service, place of service, diagnosis codes, procedures, modifiers, charges for each services, signature of the provider, authorization and referral information, and your provider NPI number. Now you're ready for submission, and the goal is a clean claim. So that's the data that you need. Now it's time to move on. And also, too, I want to make you aware before I go, I want to make you aware that there in your LMS, there is a link to an interactive CMS 1500 form. It will go um, column or I don't know, column by column by column and tell you what belongs in each column of the CMS 1500 and row. All right, so I love it. I use it all the time, and that is how I know what belongs where. All right. So if you have any questions, go ahead and type them in the chat. Now it's time to move on to task number 2. And our task is to interpret the insurance responses to identify the appropriate course of action. All right, what is insurance responses? Well, this is the insurance's communication. This is the insurance benefit statements. You'll have either an EOB or an electronic remittance advice or ERA. And the difference between the two? The EOB is what the patient receives, and the ERA, that's what the hospital receives. So after you've submitted the data to the insurance company responds with the benefit statement, EOB to the patient, ERA to the hospital. Now, I have a quick video on EOBs, and let's take a look.
An explanation of benefits, or EOB, is a paper or electronic document you receive after you see a doctor or other healthcare professional or get medical services or equipment. You'll find information about your claims, payment information, and more. Your EOB helps you understand how your plan pays claims so you know what was paid by Horizon Blue Cross Blue Shield of New Jersey and what, if anything, you owe. Now let's learn more about your EOB. In this example of an EOB, you will see date of service. This is the date services were provided to you. Type of service, which gives a brief explanation of each service provided. Billed amount, the full amount charged by the doctor, other healthcare professional, or facility for each service. Allowed amount, the amount Horizon Blue Cross Blue Shield of New Jersey approved for payment based on your plan benefits prior to the deductible, coinsurance, copayment, or other member cost sharing, if applicable. Your coinsurance or copayment amount, the amount you pay to the doctor, other healthcare professional, or facility after you have met your deductible, if applicable. Your deductible amount, the amount you are responsible for paying to the doctor, other healthcare professional or facility for the service provided before your insurance begins to pay for eligible services. Other carrier payment amount, the amount paid by another insurance carrier, if applicable. Not covered amount, the amount charged for the service that is not covered by your plan. This can be for expenses not covered or in excess of your benefits. This amount may be in addition to any deductible, coinsurance, or copayment. Horizon Blue Cross Blue Shield of New Jersey paid amount, the total amount paid to you, your doctor, other healthcare professional or facility for the services performed. Message code. This shows the codes explaining how payment was calculated. Subscriber responsibility. The amount you owe the doctor, other healthcare professional, or facility, including any copayment, deductible, or coinsurance, if applicable. You can also view, save, and print your EOB by signing into Member Online Services at horizonblue.com and clicking Claims. To learn more, visit horizonblue.com/EOB. Thank you for viewing.
All right, so that is pretty much how to read an explanation of benefits or EOB. And this is what the patient receives. Now, this is what the provider will receive. And if you work in a billing office, this is what you will see. So you'll get your remittance advice, and often there is a summary at the beginning, and this is specifically for this
Jay,
practice. Uh-oh.
excuse me. We can't see your screen. Thank you.
All right, I did put it on and just flip back off. Okay, thank you so much, Miss Eva. All right, so this is what you will see: the remittance advice. Your Highmark Blue Cross Blue Shield um, is the provider of the payment or the insurance carrier. Your provider is ABC Family Practice, and this you can see is direct deposit summary. So they put this directly in the account. This is their remittance. Now, let's take a look at a sample remittance advice. And the first thing you'll notice, it looks a little bit like an EOB, but you have one patient, another patient. So you have about three, this is four patients on this one remittance advice, and it does give you the information that you need. You've got the patient's name, the date of service, the place of service, those 11s, um, your procedure codes, your modifiers, and your billed amount. But what's important in medical coding, in billing? It's not the billed amount, it's the allowed amount. Because often these providers have contracts with the carrier, and the allowed amount is the only amount that they can consider. So they're going to have to write off any excess. So if they build 180 and the allowed amount is 4416, that's the contract that the provider has with the insurance company. Also, in addition to the allowed amount, the amount paid is important, because the difference between the allowed amount and the amount paid is what the patient is responsible for. I'll say that again. The difference between the allowed amount and the paid amount, that's the responsibility of the patient. So how do we know? Well, you can look in here and we can see, let me kind of move this over, that the patient has a deductible here. If it's in this column, come on, let's see, all right. If they have a deductible, you'll see it in this column. If they have co-insurance, you'll see it in this column. So anytime there is some type of payment that the patient is responsible for, often there is a message. Anytime there's a rejection, a denial, or the payment was not paid at 100%, there's often a message. And these message codes tells you or tells the biller or the coder where that money went or why the claim was not paid. So let's see why, and here are the messages. So if you have message U5006, you turn to the back, and U5006 says, the patient's coverage does not provide for this service or diagnostic study as part of their preventive schedule. Therefore, no payment can be made for this service. So, if no payment is made, then it is the responsibility of the patient. However, if that is a Medicare patient, this is a question for you. If it was a Medicare patient and it wasn't paid and the insurance rejected it and it was in excess of $100, what should the provider have given the Medicare patient before they rendered the service? Do you know? That's right. That's right. They said ABN. That's right. Advanced Beneficiary Notice. Outstanding. Well, it's time to test your knowledge. Now, I do want to tell you that the questions at the test your knowledge level are going to be a lot more basic than the instruction. However, the questions, they're similar to the questions on the exam. So again, you have to be familiar, not mastery on most. Now, there's some things that you're going to have to know, and we will let you know. All right. Now I'm going to ask Miss Ida to come to the fore, please, and thank you.
All right. Question from CCSP Study Guide, Domain 5. Number 19. The explanation of benefits EOB is sent to the, I should read the answer first, but A, third-party payer, B, provider, C, patient, D, hospital. You got this, Coder?
Outstanding. Good job, everyone. And Miss Evans said, hey, you need to pick up the pace, Mrs. J. She's right. All right. So you all nailed it. The answer is C, patient. Outstanding. All right. Miss Ida. Well, she may have some technical problems. I'll read it. Which of the following is a statement sent to the provider that explains the payments made by third-party payers? A, remittance advice, B, advanced beneficiary notice, C, attestation statement, or D, explanation of benefits? Okay, what say you? And the chat says A, remittance advice. Okay, we got another one. Miss Ida, just please feel free to jump in if you can. If not, okay, take it away.
All right. How often must an advance beneficiary notice be signed when multiple insurances of the same questionable service are provided? A, on annual basis. B, the first time the questionable service is provided. C, on monthly basis. D, at the time each questionable service is provided.
Outstanding, outstanding. They are raining in the chat, Miss Ida. They're saying D, at the time each questionable service is provided. Way to go. I think we got one more.
All right. In the healthcare industry, what is the term for the written report that insurer used to notify the policyholder about the extent of payment made on a claim? A, explanation of benefits. B, summary of benefits and coverage. C, remittance advice. D, Medicare explanation of benefits.
All right. And the answer is explanation of benefits. Look at it. This is in the healthcare industry, what is the term for the written report that insurers use to notify the policyholder about the extent of payments on a claim? EOB. All right.
Thanks for tuning in, and until next time, happy coding.